CEWT Talk is a weekly 20-minute podcast brought to you by the Continuing Education Workforce Training Division of Idaho State University's College of Technology. This podcast is part of our continuing outreach efforts, and the format is conversation. We're having conversations with businesses, professionals, entrepreneurs, community agencies, and in all cases, difference makers. You can find us on Apple Podcasts, Spotify, and SoundCloud. So subscribe today. Take 20 minutes and hear from people living in your community who are making a difference in your community. It's time to get started with CEWT Talk. Hello, everyone. This is Jason Batalden with Continuing Education Workforce Training at ISU here at the College of Technology. And welcome or hello to CEWT Talk. Paul, you're on the show with us today. How are you doing?
As always, I'm doing fine today. How are you today?
Doing good. Now, do we need to warn everybody that you're going to probably get interrupted at some point by your two little four-footed roommates, right?
You know, it's because of COVID, we're doing this at home, and I'm here at home, and my housemates are grocery shopping. So at some point, I'm going to be barraged by Yorkie barking. Just so you know.
So he'll hit the mute button as quick as he can, and we'll get him back on.
I will.
That's right.
No. I think everyone wants me to share that, don't they?
Yeah, right. Oh, I don't know. Well, I'm running into the same problem too. My workmate is probably going to get real sick and tired of laying here on the floor here in a minute. But that's not what we're here to talk about today, Paul, is it?
Really?
No, I know. We have Ray Lynn on the show, and when Ray Lynn's on the show, we know that we're going to have an excellent conversation about smart stuff. So, Ray Lynn, welcome.
He's way smarter than us.
Wow. But Ray Lynn, we're glad to have you on today. But you got a big event coming up here, and we definitely want to make sure that we get some information on about that.
Yes, we are super excited. We have an emergency medicine conference coming up April 30th and May 1st. Last year we had to cancel due to COVID, and we are just super excited and very positive that it's going to happen this year. So that's April 30th, May 1st. Registration opens on March 15th. This will be located on the ISU campus, and it's a mere $20. It's a bargain for those. And that is because Portneuf Medical Center has been willing to come in and be our title sponsor to be able to help keep the cost down low for everybody. We have brought in an excellent keynote speaker, Eric Bauer. He is the CEO of FlightBridge. He's very well known in the emergency medicine world. And so we are excited to have him coming for the conference, as well as our talented physicians and presenters and speakers from all over Southeast Idaho. We even have another speaker coming in from New York. So excited. Yeah. Well,
it'll be cool just to have this event up and running again, won't it? It's such a vital and important event for our area to start with. And then unfortunately due to last year, of course, like everything else, right? But it's just exciting to have it going this year, and it should be an excellent event. And you have a special guest on our podcast today that we brought on to talk about some of the cool things. So, Ray Lynn, introduce her.
Yes, thank you. We have Heather McGeehan with us from Portneuf Medical Center. She is over in the stroke program at Portneuf Medical Center. I was going to say Pocatello Regional Medical Center, which is what it was many, many years ago. So, but Portneuf Medical Center. So we are so happy to have Heather here with us.
Hi, I'm super excited to be here. Like she said, my name is Heather McGeehan, and I am the stroke coordinator here at Portneuf Medical Center. I've been in this role for about 2 years and been here in Pocatello for 5 and been a nurse for 15 years now. I started my career in Pennsylvania in a small hospital outside of Philadelphia, and spent about 10 years in South Carolina too. And then we moved here to Pocatello, and I started to work at Portneuf about 5 years ago.
Well, that's awesome. So you're a registered nurse.
Yes, ma'am.
And what has been your specialty area
So I have spent most of my career, about 13 years, in cardiovascular nursing. I worked on the floor and as a charge nurse, and then as a manager of the unit for several years. And then about 2 years ago, I saw this job posted for stroke coordinator and it's the first time we've ever had a position like this at Fort Smith Medical Center. So I went ahead and applied for it because I just kind of wanted to focus my attention on one disease that I feel I hold very close to my heart, and that's stroke. It's the fourth leading cause of death in the United States, and it's just, very important. And there's a lot we can do to help prevent and have better outcomes.
That's awesome. Very cool.
So I do have to ask, you started out on the eastern part of the country and you've come to the western part. Was that an easy transition for you a little bit, or are you glad you did it, or is there a part of you that can't wait to go back to the wilds of the east, I guess?
I love it here. I didn't know that I had an aversion to so many people. I mean, I don't know if that's the right thing to say. But, I love it out here. Everyone is so kind, and it has been the easiest transition. I have family in Pittsburgh, Pennsylvania, that are trying to talk us into moving back, and I say, no way, you can come out here.
So, Heather, I am originally from the Boston area.
Okay.
So I know exactly what you're saying. You don't realize how being so in such a densely populated area is so draining until it's no longer there.
Yeah.
And it's actually so refreshing to when I got out here, the one thing I went and going, there's so much space.
And there is no traffic. No matter what anyone says, there is no traffic.
I know people around here, they complain about the traffic, and I just go, really? Do you know what you're talking about?
Traffic jams in Pocatello.
Right.
But Heather, going back to your position at Port Smith Medical Center, I'm not in the medical profession. What does a stroke coordinator do?
Oh, that's a good question. And that's, something I had to wrap my head around about 2 years, because 2 years ago when I started, and I had to research what I was supposed to be doing, because I was the first person ever here at Port Smith to do this position. So I found out really quickly how I wanted to do it. And we call stroke alerts on all of any patient that comes in with stroke-like symptoms that was last seen normal within 24 hours. So we call those alerts overhead, and we have a multidisciplinary team come to it. And my key role in that is I help facilitate the patient getting over to CT or help get them TPA faster, because with a stroke, every minute that you go without getting treatment is tissue that dies. And it's considered a time-sensitive emergency. So once it begins and your symptoms happen, you have a very limited time that we can treat the stroke. In fact, we only have 4.5 hours to give you some critical medication known as TPA. So getting to the hospital very quickly is absolutely important and vital in anyone who's having a stroke. So I go to all of those while I'm in-house, and I round on patients and do education with them to help prevent strokes from reoccurring. And then I collect a lot of data to see how we did and what we can do better. And I run a stroke committee with people like Dr. Bailey and Dr. Curtis Sandy in the emergency room, and Dr. Francis in the emergency room, and Brandon Clark, the ED director, and a lot of people to help see if there's anything that we can do better in the care of stroke patients. So we meet every month and review cases, and are always seeing what we can do better to treat patients faster.
Okay, so
Oh,
well, again, because I'm not a medical, I would imagine that most of your patients that you know probably start in possibly the trauma center or the emergency ward. So do you work closely with that? Because I would imagine that most people just have an illness. They don't even know, they're not even aware that it is a stroke until they walk into those emergency room doors. Is that correct?
You know, I think that, the American Stroke Association has put out a lot of education, and we're all hospitals and healthcare facilities, we're trying to make it very aware of if you're having a stroke. So a lot of patients actually come in via the EMS, which is the best thing that they can do, because the faster they get here, the quicker we can do what we need to help give them the medicine, give them TPA. So we teach from the American Stroke Association, the acronym FAST. We want, if you notice that you have face droop, arm weakness, or speech disturbance, it's time to go to the ER, time to call 911 and get in.
that's great. So do you find that a lot of people, when they're coming in, they have recognized that acronym, or is that something that's common?
Yeah, I think that there is definitely improvement. And then, there are some people who say, I had this for 2 days and I finally decided to come in. And then,
Oh my goodness.
once you have a stroke going for that long, there's not a lot that we can do to acutely, treat a patient. So we want to encourage everyone, if you have those symptoms, come in right away. And our EMS does, the EMS in town does a great job they call the hospital before the patient even gets here, so that our team is ready to treat these patients. Our ER physicians actually meet the patients out in the ambulance bay. And if their vital signs are stable and they're breathing on their own, we go straight to CT, because we need these images of their brain to make sure that they don't have a bleed. Because if you have a bleed, we wouldn't want to give you TPA, because that would make it bleed. That would make things significantly worse. So before we ever give that medicine, we need to get you straight to the CT scanner.
That's great. Dr. Bailey talked to us about the interventional radiology side of that. And so if they're able to remove the clot, that's a great option as well. And how often do you see that compared to using the TPA drugs?
So with the clot removal that Dr. Bailey is referring to, it's a stroke in what we can call them a large vessel occlusion. So we see those about, at least every month, where a TPA patient, you may be a TPA candidate, but you don't have a large vessel occlusion. It's in a more smaller artery in your brain or in the back of your brain, where they wouldn't be able to go in with a catheter, but we could still break it up with TPA. And the best practice, if you do have a large vessel occlusion, is we want to give you TPA and we want to do a thrombectomy on you. The Dawn and Diffuse trials that they've done have shown that using both methods, TPA and clot removal, will have the best outcomes for the patients.
That's cool.
You said something interesting in kind of your introduction, that the treatment, obviously you said that strokes are the fourth leading cause of death of America, in the United States. And then you kind of alluded to this is a kind of a passion for you for this sort of work that you're in. What did you mean by that, I guess, or where did this passion come from?
I work with cardio, on a CV floor, but we take care of a lot of patients, and you get a certain type of patient who has atrial fibrillation, and a lot of times people will just stop taking their medications. And when you have atrial fibrillation, if your blood isn't thin, you're at risk for a stroke. And it was really taking care of patients that have had a stroke and seeing the things that they go through. And it's really just, it's not just about the patient, it's about the family that's going to take care of them when they go home. It's something that is preventable if we're very good. There's a lot of education that needs to go out about making sure you take the medications that are prescribed, that you have low cholesterol, control of your diabetes, that we can get that education out to help prevent strokes from occurring. And then, the treatment of getting these patients in quickly and recognizing those symptoms and coming in fast is the best likelihood for a good recovery.
Cool. Heather, you mentioned education is probably the best, preventative. Does Portneuf Medical Center have any sort of educational in place for the community?
That's a great question. And that's something that we haven't formally got out to the community, but I believe it's May is National Stroke Awareness Month. And we want to make sure that we get some education out, just like we do for heart disease, and make sure we're offering that. So I think we're gonna push really hard to make sure we have that education out to the community. We do a lot of education in the hospital once you have a stroke, and we have physical therapy, occupational therapy, speech therapy, everyone really working as a team once you've had the stroke. But we definitely will be offering a little bit more out to the community here.
Heather, and I guess maybe even for Raylyn too. So here's the total layman's question. Are strokes entirely preventable? And I guess where that question came from is in your earlier comment, you talked about all these other conditions that make individuals, I guess, prone or vulnerable to having strokes. Is a stroke entirely preventable through proper physical care? And I don't know. I guess that might be the dumbest question of the day, but I'm just had to toss it out.
No, I don't think they're entirely preventable. I think there's things that we can do to take care of ourselves to help reduce the risk of having a stroke. Sure. Because sometimes our goal when you get in the hospital and once we do all the emergent stuff, we want to try to find the cause. And sometimes we can't figure out the cause of the stroke. Even, we run all the tests that we can think of, and we can't always figure out why you got a clot in your brain, but we try our best to. So I don't think it's 100% preventable, but I think we can definitely decrease the number.
Right. And like you said, that early recognition and recognizing that it is time-sensitive emergency. That is actually the theme of our conference. So it fits so well into that time-sensitive emergency and getting that help, recognizing and then getting the help. And so is there anything that, like, as far as details about early recognition and the difference in outcomes that you'd like to tell people about?
For the early, the reason we want this early recognition is because then we can offer you the medication, TPA, the clot busting medicine. The studies have shown that if you receive TPA within 4.5 hours from your last known well, you might not even have that immediate, my symptoms all resolved, but the studies have shown that you'll have faster improvement within 3 to 6 months if you receive that medicine. So we just, we want everyone to come in right away and just act fast. I don't think we can say it enough. Facial droop, arm weakness, speech disturbance, it's time to come to the ER, time to call 911.
Sounds great. I know that at the EMS night out that your team talked about some of the rural areas and what you were doing to help to support those rural areas and helping those people get the treatment as quickly as they could. Maybe mention that a little bit.
Yeah, so we definitely, I'm part of the Idaho Regional time-sensitive emergency team, and we meet every 2 months. Dr. Sandy runs that team, and Greg Vickers with the trauma program, and we talk about STEMI, stroke, and trauma, and what we can do to support each other, and we share best practices. So almost all those facilities have the ability to give TPA, and we work with them to have standard processes to help them get their patients to us quickly if they are having a large vessel occlusion, so that our IR team can come in rapidly and get their lab ready and have those patients on the table really fast.
That's so cool. Very awesome.
I shared this in the podcast with Dr. Bailey, and I don't want to. I feel kind of weird sharing it again, but my father had a stroke this last summer. And it was here. I live in Idaho Falls. He lives in Idaho Falls. And we were able to get him into the hospital. I tell the story that my mom called me at 10:30 on Sunday morning and said Dad was on his way to the hospital. I was able to sit with her in the emergency room. And at 11:45, the physician came out and said that they had removed a clot from his brain. And I shared with Dr. Bailey, I said, the funny thing is, he's down in Arizona right now golfing. And when you think about the fact that he had a rice kernel-sized clot in his brain, in late August, and now he's functioning very well, that says something to, your techniques and, how well prepared teams are and stroke teams are in hospitals to address those issues. So, it is amazing to me. I remember, it's an amazing thing to think that you have this at one time could have been, if not fatal, at least life debilitating experience. And now he's as grumpy as ever. So,
So Jason, did he recognize the symptoms, or did
they were coming out of church, and he handed my mom the keys and said, "I'm not feeling well. You better drive." And as mom was coming around the car to get the keys from him, he fell down on the ground.
Oh.
And lucky for, I don't know, that it was after church. So the parking lot was full, and, a bunch of people ran over, and one of the people running over had their cell phone out dialing 911 before anyone even said to call 911. And the church they were attending was less than 5 minutes away from the hospital. So, you go back to time, time was a crucial player in that. So that's how it went down. Right. And so I don't know if I don't know if anyone identified that he was having a stroke, as much as they watched an old grumpy guy fall down in the parking lot. Somebody had to wear to dial 911. So
I had a friend share with me, she's probably in her 40s and was under a tremendous amount of stress at work and actually felt like she was having a stroke. And so she went to the emergency room, and fortunately, she was not having a stroke. And she said, "I feel kind of silly." She said, "But I'm so glad that I went just in case." She said, because, she recognized, she knew that how important it was. So you should never feel foolish, right? If you go in and you have symptoms and you're thinking, but yet it doesn't turn out to be that, that's okay, right?
I think you're right, Raylan. I think so many people just fluff it off going, I just don't feel well today. Maybe I'll feel better tomorrow after a good night's sleep.
Right.
And I never heard of that was fast until you've mentioned it, Heather. So I'm going to remember that now. How could I not remember it now? And I'll look for those symptoms. It's one of those things where, most people just go, I'll feel better after I have a night's rest. Or no, it's something I ate.
Yes.
So Heather, I guess kind of going to just touch on your point. There is something about going back to what you commented about is being in a profession that significantly impacts the quality and the well-being of someone's life. I imagine that that does kind of help you get out of bed in the morning on those days you're maybe not in the mood to go to work, I suppose.
It fills my bucket. It really does.
Right
it fills my bucket. I got 3 kids at home, and knowing that I'm going into work and feeling like I'm making a difference, it really, makes me feel better about leaving them at home.
Well, that was the magic timer. And I don't know if that felt like 20 minutes. So, and Heather, I appreciate you being kind of my therapist today and let me share again, share about my father's trauma experience. So thank you.
Well,
I feel a little bit ridiculous. What? I'm sorry.
I said, I'm glad he's out golfing.
Yeah, so am I. Yeah. So am I. So am I. I think that's good. But so, Raylan, I just want to kind of toss out again, April 30th, May 1st, the Emergency Medicine Conference. And Heather, you'll be at that conference, I'm assuming?
I'm planning on being a part of it. Yeah.
I just put you on the spot, Heather.
I was going to be there with Dr. Bailey, to help assist with what he needs either way. So
right on. And I'm assuming too, Heather, if anyone has any questions just about stroke or to reach out to Portneuf Medical Center, Google on the website, all that good stuff. I'm sure you have people there that will love to share information with them and help them learn more about it. So I can't tell you, thank you for being on our show today.
Thank you for having me.
Yeah. And one last time, what was that again?
FAST. Act fast. Facial droop, arm weakness, speech disturbance, time to call 911.
Excellent.
There we go. And if you want information about anything else but stroke, you can contact us at cetrain.isu.edu. That is cetrain.isu.edu, or you can call us at 208-282-3372. And if you have questions about strokes and treatment of strokes, and that's when you get a hold of people like Heather McGeehan and the Portneuf Medical Center. So, Raylan, thank you for guiding us on this podcast, and thank you for asking the right questions. And Heather, appreciate you tolerating Paul and I and what do we do now questions. So we appreciate that. So thank you very much.
Thank you.